Good evening, friends. I'm Dr. Abhilash Tiwari, and today I'll be just trying to explain you in a simplified way the causes of sudden cardiac death in the young population as what we can encounter. Many a times I know the patients will come to you after hearing in the newspaper that some of the known relatives who was not having any comorbid risk condition or they died suddenly the very next morning, and very common notions that the patient died from heart attack. So you being a doctor, what precaution you should take in assessing these types of patients, we'll try to discuss this in a short while. First thing, whenever the patient comes to you, to your clinic, that after hearing such news, first you try to assess is the risk assessment. What do we understand from the term called as a risk assessment means you have to find the individual at the increased risk of sudden cardiac death, from which you have to obtain a very good history and a focused examination. Ask about the smoking history, ask about the use of alcohol, ask about the patient's lifestyle, that whether they are doing regular exercise or not, check the blood glucose, check the blood pressure, look for the lipid profile, and very importantly, friends, always try to ask whether in their family any of the first degree relative have any premature cardiac episodes. In other words, I can say sudden cardiac arrest or ischemic heart disease. Do always ask in the family if they have. If they say yes, they had some history, then these are the individual who requires more subsequent investigations. Like for example, you should order them the electrocardiogram, you should order them a 2D echo. In certain selected cases where there is a congenital familial tendencies, so-called cardiomyopathies, in certain selected cases you can recommend the cardiac MRI, and you can order for certain Holter monitors as well. For example, in those patients like hypertrophic cardiomyopathy, right ventricular cardiomyopathy, Brugada syndrome, WPW syndrome, and hereditary long QT interval syndrome. So in these group of patients, try to understand, take a baseline ECG before you recommend any exercise regimen. Very important in the current scenario, what we can see that a lot of patients are often taking a recreational drug. The commonest reason for the myocardial infarct or the precipitation of the unstable angina is the use of cocaine as well as the heroin. The cocaine is very common. So any patients with unexplained presentation, premature episodes of coronary, you must always ascertain the history of cocaine and illicit drug. You can send the urine and the blood for the toxicological assays. There are certain rare conditions, what we call it as in hypercoagulable conditions, which can present with a sudden death. But before than that, the patient may have some episodes of vascular thrombosis somewhere in the body. So one should be very careful about it while assessing the history. So in short, for all clinical purpose, you must always order the blood pressure, blood glucose, look for the lipid profile, assess the smoking history, assess the alcohol history, assess the lifestyle, check for the ideal body weight. Apart from it, assess whether the patient is having a sedentary lifestyle or is doing a regular exercise, and very important, a family history of premature coronary episodes. Apart from it, do not forget to obtain the drug history as well as the history of illicit drug use, especially the cocaine. And in certain subset of individual, you can order simple ECG, echocardiogram. In selected cases, you can order the cardiac MRI, and last but not the least, the Holter monitoring. With all this as a first line investigation, for all the patients, you can recommend whom you suspect to get increased risk of development of premature coronary episode or sudden cardiac death. As far as the COVID pandemic is concerned, definitely the COVID infection predisposes to the hypercoagulable state, so we'll not discuss this right now, but it is a matter of serious concern. So all the patient comes to your clinic, do not forget to check all these things. Thank you very much.